Good morning. I prepared a statement on what I've learned about mental health crisis response. We as a society have placed an enormous burden on police services to solve crises deriving from mental health, substance use, and homelessness. 50 years of failed mental health policy has placed law enforcement on the front lines of mental illness crisis response and turned jails and prisons into the new asylums. Deinstitutionalization, outdated treatment laws demanding a person become violent before intervention, discriminatory federal Medicaid funding practices, and the prolonged failure of states to fund their mental health system drive those in need of care into criminal justice and correction systems rather than into the public health system where they belong. An estimated 7.9 million adults in the United States live with severe mental illness that distorts their thinking. Treatment, in most cases, can control psychiatric symptoms common to these diseases, but the system that once delivered psychiatric care for them has been systematically dismantled over the last half century. Given the prevalence of mental illness in police shootings, reducing encounters between on-duty law enforcement and individuals with the most severe psychiatric disease may represent the single most immediate practical strategy for reducing fatal police shootings in the United States. Evidence-based treatment for severe mental illness exists. The disproportionate risk of criminal justice involvement associated with mental illness occurs chiefly among the less than 2% of the adult population with untreated severe mental illness. Treating the untreated is a proven practice for reducing the role of mental illness in all criminal justice involvement, including in deadly law enforcement encounters. So where do we go from here? Local governments are establishing innovative and proven programs to foster community safety outside of their police departments. Cities everywhere from Rochester, New York to Albuquerque, New Mexico are launching first response programs to meet mental health and homelessness related 911 calls with the right response at the right time. Cities across the country are investing in community-based violence prevention to treat violence from a public health approach. Real change is possible in the current moment with the perfect storm of innovative thinking, the audacity to reimagine public safety, and the public support for the systemic change. Yet, without the financial investment to scale up these transformational safety strategies, we will miss the moment to impact change for our community and for those whose lives depend on it. As our community demands racial justice, it's clear that a new first responder system that sends help instead of handcuffs is needed and desired. More and more cities are turning to crisis prevention teams to assist law enforcement when it comes to calls from individuals suffering from mental illness or experiencing traumatic episodes. We need to ask ourselves, are we sending the right team to assist in a mental health crisis? It is time to invest in evidence-based programs that do work. Mental health emergency response, violence prevention programs, restorative justice school-based programs. I'm asking the council today that we invest in mobile crisis teams that will send the right team to respond to meet the needs of those suffering from mental illness. Thank you. Hi. So the model we looked at was in Eugene, Oregon, which has been taking place for the last 30 years, and they've been quite successful. And their team involves a separate mental health team that works in conjunction with the police department. So that team is comprised of mental health professionals, psychiatrists, their education and de-escalation tactics. They're also radioed into the police. They would be. The example in Eugene, Oregon is they're wired into the 911 dispatch center. So if they come to a mental health crisis where they may indeed need the help of the police department,